We're going to do something a little different in this segment. We're going to talk to Mark Dunn, New Era Health Plans. His website, ourplanrocks.com. We're going to save you some money on what is the other mortgage in your life, healthcare, and those costs. Mark, good to have you.
Yeah, good morning.
A lot of entrepreneurs, especially listen to our program, and that's been a really expensive line item lately. We had you on my show, close to a year ago. We talked about solutions for Obamacare. What's changed since then? What's happened with the president's tax plan? How does that impact health insurance and what you offer folks in a general sense?
Well, nothing. A whole lot hasn't changed yet. It's changing as we speak, pretty much. Our plans were innovative in the last couple of years, so we pretty much have stolen a big section of the market because we found a way to be outside of the Affordable Care Act and still give people good coverages. I expect some additional changes between now and sometime early next year or so. Right now, our type of plans, by being able to take a hospital indemnity plan for hospital indemnity, which is hospital and surgery coverage, and adding additional outpatient services to it, is the best thing that you can do outside of the Affordable Care Act right now.
So, was it my understanding that tax plan changed so that plans like yours now can, if you just have a plan, it doesn't matter because you have no penalty by using an indemnity plan like this. Is that what's coming? Is that how the tax plan changed things?
Yes, as of December 31st, there's no more penalty. There still is the option of a penalty now, but most people, there's so many ways to get around the penalty, you wouldn't pay it even for the balance of this year. So it's where it's technically still in. Most tax accountants that I know are saying that you would never pay the penalty. So
basically, at one point, to avoid the penalty, you were packaging together what would be called an indemnity health insurance plan, and I'll ask you specifically about what that is in a minute. And you were packaging that with like the Christian medical or those types of programs where it's kind of a shared pool, which does qualify for Obamacare, and that gave you the exemption to paying a penalty. Do you still need to do that packaging, or is the indemnity enough?
You don't have to do that anymore. You can still do it if you want like a secondary reassurance to like on major bills, like $100,000, $200,000 bills, something like that. If you want a backup program, it's real inexpensive to put those on. We don't do as many of them as we used to, but we still do add that occasionally.
But your indemnity plan basically gives you coverage. It gives you sort of a flat fee for each type of service. So what if you had like a heart issue or cancer or some of the major medical issues on an indemnity plan like you have at ourplanrocks.com as your website? How does that work for the average, especially the entrepreneur or someone who's struggling to find affordable health coverage? What's it look like once they have to go to the hospital for those big majors?
Well, I had a client who fell down some steps. He ended up passing away after 9 days in intensive care, and the initial billings were $220,000. If they would have stayed there, we wouldn't have looked too pretty in the situation. However, nobody pays the actual bills you're seeing from hospitals. They're ridiculous. You get these bills which are like 10 times Medicare sometimes, and then you look up what they end up paying. They end up paying about 1.5 to 2 times Medicare. So that $220,000 bill got reduced to $102,000. When it got reduced there, we ended up paying the entire bill for the client. We can do that. The same thing on a heart attack. It's what it's about though is about getting the right price. And we're working on getting price transparency, and we work with other groups of doctors and the hospitals and all, which are also trying to be more transparent these days, so you'll find out what things actually cost. It's a hard thing to do, but it's what we're working on right now. And once people get the right price, then our plan pays substantial portions of the bill, generally most of the bill, if not all of it in many cases.
All right, so we're talking to Mark Dunn, New Era Health Plans. Their website's ourplanrocks.com, ourplanrocks.com. And, I think we were looking at $1,300, $1,400 a month for my family of 4, 2 kids, obviously my wife and me. And then I think you got us done around $700 a month, and that's the indemnity plan that we're talking about. So it's a huge savings. It doesn't always cover everything up front, but a lot of times, we had you on the show the first time, and you gave a piece of advice that whether they're on your plan or any plan that was very helpful to us, and that's the availability of the teledoc, which is you got the sniffles, and the flu was floating around this past winter really badly, and we wanted to go ahead and talk to teledoc and get some Tamiflu so that, number one, if there was a shortage, we wouldn't be caught up in the shortage. And number two, if someone started showing signs of the flu and we're having trouble getting into a doctor, we'd have it on hand. So we were able to get a doctor for free. They prescribed a starter package of Tamiflu. And one of our kids seemed to be getting sick with the flu, and we were able to give them the starter package, call back in again, get the rest of it, and basically not have to go to the doctor and spend any money. So essentially, while your plan wouldn't have covered all of the doctor visit, perhaps, maybe it would have, we didn't have to worry about that because we had Teladoc. So these kinds of approaches to this extremely egregious and expensive healthcare market have been very helpful because it empowers the consumer in a very non-transparent place, which is health insurance and healthcare, to be able to make some decisions to avoid the cost and still get the care. I don't. That's not a question, but I'll have you react to what I've just said.
Yeah, Teladoc's been a real help to all of our clients. It's a great service. You get board-certified physicians and pediatricians 24 hours a day. That's a great service. There's no charge to it. Some of our competition charge up to $60 every time you call Teladoc. We do it. It's included in our program. They do a video conference for you online or on your telephone or on your computer. They can actually look in your child's ear or look at how you're looking. They write prescriptions. It's a great little service, and they're looking at expanding to a lot of additional things over the next couple of years. And we hope to keep them on board with us for many years to come.
Yeah, it's a future of medicine.
You can also go to any doctor you want to, and we still pay. We pay like a flat fee of either $80 or $100 per visit. And most of my clients will ask a doctor what a cash price is, and it's coming out between $80 and $100. So we're paying most of the doctor visit fee for you also.
Yeah, before we joined your plan at New Era Health Plans and ourplanrocks.com, we were, I think it was $1,300 a month, and that was Ambetter or somebody like that. And we had a $6,500 deductible per family member up to a total max family deductible of $13,000. So when we go to the doctor at $1,300 a month in health insurance, and we would pay in full, there would be no benefit, and we did have a prescription copay of $20. I found that once we fell off of, I had one prescription that was a pre-existing condition, so obviously that wasn't covered in the new plan. I found that when I came off of the Ambetter and went to your plan, that when I started using specifically either your prescription discount program that you offer your clients or a Good RX, which is another one that's out there, I found that I was now paying $13 for a prescription that wasn't included anymore, but I had been paying a $20 copay. So sometimes if you get the right generic and the right prescription makeup, you actually can come off of prescription benefit and save money. And that's it was sort of shocking because I'm like, this is a $60 drug on paper. And with a discount, I'm at $13 at Walgreens, that specific pharmacy with this specific drug and Good RX in that case. And I had been paying $20 blindly like an idiot. I mean, I'm sure you see that a lot, Mark.
Yeah, we see a lot of things with prescriptions, and since you've enrolled, Bryan, we now offer a prescription drug card for the people who need it. But if you're not paying very much for your prescriptions, it's not worth the extra money. But that's an option. You don't have to. It's not forced on you, and you can also add it later on. So if you're not taking anything now, and then all of a sudden 6 months from now you get some really expensive medications, you can ask me to go ahead and put that prescription drug program on, and they'll put it on there with no pre-existing conditions.
Wow, that's pretty cool. Don't quote me a number, but in general, how's the pricing on that compared to the rest of the insurance market? About the same?
Yeah, they start off about $40 a month, and they go to about $58 a month based on generics or name brand and how much of the name brand you want covered.
Oh, that's pretty cheap. We might ought to talk about that. I also find too, and I'm just throwing this out, after we got on your plan, you kind of have coverage for various different things in various different circumstances, but I think the nature of getting on a plan like your indemnity plan causes you to think through your insurance a little bit more proactively, and starting to have conversations with doctors. My son takes a particular medication, and we said, hey, why don't you just give us, it's a twice a day kind of thing, why don't you just give us the double dosage and we'll just split it in half, and the doctor prescribes it, and literally the dosage only went up about $10 a month for 30 pills. Let me say that the right way. It didn't go up at all. Actually, it wasn't but about 10% higher for the added milligrams, which means we cut down the cost of that second pill by 90%. So, you were paying $33 for it. Now you're paying $37 for a pill you split in half. We're paying $33 times 2. So it's like $66 comes down to the upper 30s. Those kinds of maneuvers, when you have those conversations with your doctor and when you're really seeing the cost of your prescriptions, the way your plan works, and then you get your money back or it gets paid through the prescription plan, you start to really see how you're getting hosed in healthcare, not health insurance specifically, but healthcare. Where do you see all this going, Mark? By the way, we're with Mark Dunn, New Era Health Plans, ourplanrocks.com. I'll let you pick up.
I'd like to give you one quick example of what's going on here right in Atlanta. If you go to Northside for their outpatient facility for testings and stuff, if you walked in there and you have a bronze plan with the ACA, the Affordable Care Act, you got a $6,000 deductible. You walk in to get an MRI scan, it's around $2,000. If you look down their sheet, what they've actually provided for now is a transparent pricing where if you pay up front, you'll get 75% off. So if you don't pay attention, you'll give them your card from the ACA, and they'll put that $2,000 towards your $6,000 deductible. You'll pay the entire bill. If you just look down the sheet, you can check off and say, I'll pay cash or put on your credit card. They'll charge you $500 total for that same MRI scan. It's ridiculous what's going on out there in our healthcare system. Transparency in pricing is what we're pushing for across the board, and you're seeing a lot of doctors, a lot of facilities in the area start catching on that they have to start telling us what things cost up front.
Yeah, without getting too detail-itis with our audience, this kind of plan makes you, in a very positive way, really pay attention to what's happening with your healthcare, and you start to find a way not only to cut your monthly premium way down, but also to cut your transactional cost as you go along way down. It's ourplanrocks.com. We're going to be putting you up with a special page on our website at therealestateexperts.com as well. Mark Dunn, New Era Health Plans, ourplanrocks.com. It's that simple. Go to his website and find out more. Mark, good to have you here.
Okay, you too, Bryan. Nice talking with you.
Coming up next, I'm going to tell you why the FBI scandal and the Trump administration is nothing. I've been watching scandalous government for years, and I'll share with you an example you don't want to miss next.